I'm here with Sophie because I can't do a video with one twin and not the other, right? Always doing skin to skin as much as I can with both of them. So Kenzie, she has this like what's called hypotonia, which is like low muscle tone. When she is awake, she does move around, right? And has the normal reflexes and responses you'd expect a newborn to have, but everything is just not as like vigorous as you'd expect. When she is, and same thing, like when she's sleeping, she's just a lot more like floppy. Obviously, when even adults, right, when we're sleeping, our muscles are gonna be more relaxed and we're a little bit more like limp, right? So for her, it's more. And she's just in general more sleepy. The good news is that all of the tests have been normal. The bad news of that is that we just don't know, and it doesn't give us like a diagnosis. The differentials or the possible diagnoses, it's pretty broad still. It could be something. It could be some genetic syndrome. It could be infection or metabolic disorder. It could also be like preterm babies can behave this way. She's on the early side, but she's not preterm. Lots of things have been ruled out so far, which is great. The next steps we're looking at is just more genetics testing. Unfortunately, genetics testing takes a long time to come back, so it could be a couple more weeks before we have any answers. There's still a chance that it'll all come back negative. Then there's maybe a couple other like neuropathy, nervous system related disorders that we could look into. It's been like a little over a week now. Ray and I have had a little bit more time to process that we wouldn't be able to go home with two healthy babies. I think we're doing pretty well considering. We're obviously pretty worried about Kenzie. Really trying to be present for Sophie and also present for Kenzie when we're with her. Right? For me, the last couple of days, I feel like there's a little bit more acceptance for me that this is just it is what it is, right? Kenzie's in the NICU and Sophie's at home with us, and we don't know when she's gonna get better. We don't know what's going on. We don't know if or what kind of intervention she's gonna need and for how long. And as much as we want to know if she's gonna have a normal life, nobody knows that answer right now. The idea of a normal life, right? What is that going to look like for her? And, truly no one knows right now. And I think that there's a possibility that we may need to adjust our expectation of what a normal life and what being okay will look like for her. Anyways, we appreciate everybody thinking of me and Ray and Sophie and Kenzie. Definitely still keep sending us lots of love and prayers, especially to Kenzie. Thank you.